All right, joining me on the phone right now, we have Dr. Tyler Barnes, a pediatrician. There's Floyd, and good morning. Glad to have you.
Hey, Tony.
Dr. Barnes, the baby formula crisis right now, and when you became a pediatrician, did you ever think you'd have to face something like this? I mean, this was going to be popping up sometime soon.
No, sir. I didn't. After 2020 and COVID and everything, we should have expected it, but with all the other craziness going on. But no, we didn't expect we'd be facing this. Not with how formula was still in the shelves, 9 months ago. So.
Well, what are parents to do right now if it's pretty scarce, even though the cavalry is on the way with some more formula and everything, and they're trying to get things going back up to Abbott. But in the meanwhile, what do you suggest for your patients?
So the biggest thing with these the shortages, if people come in and they're taking a certain formula, let's just say they're on Similac or they're on Enfamil, whatever. It could be a gentle formula. It could be a regular kind of formula. First thing I'm telling parents is to just switch to whatever you can find. So if you can find a different brand that is the same, let's just say it's a gentle formula. If you can find the alternative brand that's the same gentle formula, buy it, get it, pick it up. If you have to just pick up a totally different kind of formula, you can do that too. Most babies do just fine with whatever formula you give them. There is a 5 to 7 day kind of turnaround time, so when you change their formula, they might spit up a little bit more, have looser poops, those kind of things. Mm-hmm. But that's usually, that's my big advice is just swap to whatever you can find. It's better to feed the baby than anything else. The big kind of caveat with that are your babies who are on specialty formulas. You have some babies who are on hydrolyzed formulas, meaning they've got a true milk protein allergy, things like that. They have to be on specific formulas. In those cases, I'm usually telling people try to call the manufacturers. Sometimes call, a lot of these parents are already plugged into gastroenterology, calling those doctors as well. As of now, in my office, we don't have a whole lot of samples, but I do know that in the past, generally we have some samples of different kinds of formula too, and so always call your pediatrician's office first off and just see if they have anything that can, even if it's just a can that can get you through a couple of days. That's another kind of option in those kind of kids.
What if, you're in a situation where you can't find anything right now? There's nothing. Is it safe to substitute temporarily for maybe whole milk or maybe soy milk or something that can give them some kind of nutrition?
So soy milk, I'm not totally sure if I would give my baby that, but whole milk for sure. Again, that is not ideal. Really, anything under 6 months of age, you really don't want to use cow's milk. But after 6 months, you can use it if you need to for a few days, assuming that your baby is taking some solid foods, eating some iron-rich foods. And around 6 months, a lot of that is just going to be those kids who are eating, the little teething crackers and wafers and things like that. They have a lot of iron in them as well, but green beans and stuff like that. But if they're eating a pretty balanced diet, you're okay to kind of give them cow's milk. Underneath 6 months, if they're not started solid foods yet, you probably want to be careful with that. Toddler formula is another kind of, it's an okay alternative. That's only if you just have nothing to give your baby. You can try a little bit of toddler formula. A lot of people, what's the difference? It's just a caloric difference. There's just different amount of calories and nutrients and stuff in that kind of formula that is not necessarily good for a little baby. And so, again, if you have to use it a few days until you get something else, that's totally fine.
What about some of the meal replacement things like Ensure? I know those are made for adults and older adults as well, but Ensure, that does have some vitamins and minerals in it. Is that safe to give an infant? Yeah,
I would be careful with that. You're kind of getting into that toddler formula kind of stuff when it comes to that. I think that's, again, case-by-case basis. If you just had nothing on the planet to give your baby and that's all you had, you could probably give them a little bit. Most babies, again, will do okay with small amounts of some of this stuff, but with the differences in the calories and things like that, some of those babies, it'll make them sick. That kind of leads to, I've had a lot of parents ask about homemade formulas. There's recipes and stuff from, a long time ago, homemade formulas. I do not recommend against that. Those can actually be dangerous, and there's been reports of infants actually getting hurt, being hospitalized from it. So kind of on that same vein, anything like Ensure, anything that's more for adults, I would be very, very cautious about using something like that. Again, toddler formula for a couple of days, whole milk for a couple of days, fine. But some of the other stuff, just kind of be careful with.
Well, we've had reports that the Nestle company, they're going to be importing, and I think we've actually sent some U.S. cargo planes to pick some of this formula up. What is difference? What is the difference mainly between some of the European formulas and the U.S. formulas? I think one might have been shelf life, but as far as the nutrients go.
I think most of them, you just have to look at each individual formula. A lot of them are actually pretty similar. A lot of it is just FDA regulation kind of stuff. And so a lot of the stuff over in Europe is totally fine for them to use, but they have to make sure that the temperature and everything else is safe whenever it gets transported. So there's lots of regulations behind that. So most of it's just FDA kind of stuff. And so if you had to use that, I've actually had parents in the past who've used random formulas from Europe anyway for their babies. They have a particular one they want to use, and they'll actually order it off Amazon and other places. And so that's another place I'm telling people to kind of look, go on the internet, go to really small stores, supply chains, places like that you can try to find some formula. I know some people on social media as well who have excess formula. People are trying to give it away. Hey, my baby doesn't need this anymore. So those are other ways you can kind of try to look and find formula as well.
There was a story in the news yesterday. A woman had donated her own milk, breast milk, to some moms in her community. I mean, it was a lot. Using other, if a nursing mother has excess, is that safe to transfer over to another baby?
So that is, again, kind of an individual scenario. I had a mom ask me about it the other week. Her sister or something like that had some milk and they were going to give her. Again, if you're taking somebody's breast milk, you just have to remember you don't know what kind of infectious diseases or anything they have. And so things like that can be transmitted through breast milk. So if you're going to accept breast milk like that, you just have to be really, really careful who you're taking it from. I wouldn't go on the Facebook Marketplace and buy some breast milk from somebody. But if it's a friend or a family member that you trust and you want to do that, I think that's totally okay. But again, just be safe. A lot of times they do have milk banks. Apparently they're getting overwhelmed with requests for milk right now, so there's breast milk banks. That milk is actually that's regulated breast milk, so they actually make sure and purify it, make sure there's nothing in it that's harmful to the babies from an infection standpoint. And so that's another option to kind of look into. But again, just be really careful if you're going to take random breast milk from someone else.
Well, this is definitely a situation I have never experienced in my entire life, and I know it's got to be very frustrating for young parents that they've got a newborn and it's like, wow, all this, and if the mom's not nursing, then this is another whole situation they have to go through. And Dr. Barnes, any closing advice you would have for those that are they're looking, they're needing, and what is your ultimate bottom line advice that you could give to a parent?
The end goal is feed the baby. Whatever you got, you can feed them. It's a matter of just keeping the nutrients up, even if it's just a couple of days until you can find something else. The other thing I didn't really mention earlier: don't be afraid to use off-brand formulas. Store brand formulas. Some people are kind of hesitant about that. What about Sam's Club formula? What about Walmart formula? That stuff is totally fine to use. The other thing, there's been a lot of breastfeeding shaming and stuff online. If you just breastfeed your baby, So just be careful talking to people about that. You just never know what other people have been through. I've had lots of parents who they wanted to breastfeed their baby. Their milk never came in. They just couldn't do it. And It's very distressing to mothers for that. And so sometimes it just doesn't work out. And in that case, formula is their only alternative. And so a lot of people feel guilty enough as is if they're having to do that. So just be nice to everybody and treat them with respect. So.
Yep. And just follow the advice of your pediatrician, and hopefully they'll have some resources they can to help you out a little bit on that. But Dr. Tyler Barnes, thank you so much. Floyd pediatrician.